All right, Dr. E from Northside Ghetto, STL, Ferguson, Missouri, where the people who don't know nothing is at. Look, the role of cannabinoid receptors in renal diseases. This is PubMed.gov. If you're not familiar with it, it is where scientists post their results and the government can hide it from you. So what I want you to know is this site is important because you can find a lot of data. Now, we know the endocannabinoid system is important, so we're going to see what they found. Our results, we gathered data regarding the current states of knowledge of the cannabinoid system in normal renal physiology and in various experimental, whatever that word is, especially diabetes. We also received data obtained in models of diabetes and obesity as well as non-metabolic models of renal fibrosis when CB1, that's cannabinoid receptor blockers, and CB2 agonists were used. We also found very few data are available so far regarding the cellular pathways involved downstream of the cannabinoid receptors in the development of renal fibrosis. But we do know that the cannabinoids run on those receptors and that the cannabinoids that are pure heal. Overall, we found that the cannabinoid receptors are a promising target in the development of renal disease and fibrosis, particularly in chronic kidney disease and diabetes. Moving right along, same site to give you some more insight, the role of cannabinoid signaling in acute and chronic kidney disease. I'm going to skip down so that you can grab some information. You can find these pages on your own and read for yourself. But please understand that a lot of times they're trying to create synthetic drugs to duplicate the drugs that naturally, the elements that naturally run on the cannabinoid system of the human body. And these synthetic drugs are toxic and have always been dangerous, and they can't duplicate what the creator has created for the maintenance of the human body. So read right here where you will see the newly established role of the endocannabinoid system in the kidney might have therapeutic relevance as pharmacological modulation of the endocannabinoid system. See, using drugs to modulate it has renal productive effects in experimental animals, raising hopes for future potential applications in humans. But it would make more sense to, instead of using synthetic, to just use the damn natural element and heal yourself. There's been a number of report cases of acute kidney injury associated with the use of synthetic cannabinoids that appear to have higher potency and rate of toxicity than natural cannabis. Important. Listen to RicK.
Just something I would like to mention here. Now, I've never been a big fan of CBD. I know most people don't really know all of this, but THC is the cancer killer. And this is what you got to remember. Now, CBD in hormone-driven cancers such as breast cancer, CBD can have some good benefits. There's no question. But in most of the cancers I've seen, lung cancer, bowel cancer, whatever, brain cancer, the higher the THC level, the better. And I've always said.
So these people trying to force placebos down your throat, and CBD is a buzzword. Don't fall for the trick. But check this out from RicK.
It's a lot like Dr. Michelin said. It's the entourage effect of all these different cannabinoids working together. But you see, today they're trying to separate them, CBD, or CBN, and all these different cannabinoids. There's well over 100 of them. The drug industry would like to separate everyone and say, well, this is good for that, and this is good for something else. It's a bunch of nonsense. Take the damn extract, and it might make you high in the beginning. I won't deny that, but getting high never hurt no one. And the thing is, once you become accustomed to an extract, you become immune to it. That's how I get people up, usually within a month, up to about a gram every 24 hours. But if you get up to that dosage, and if you get a different extract from a different strain, and you take that same dosage, you're going to get as high as a kite. But again, nobody ever died from cannabis. All of these cannabinoids are important, and so is CBD. But like I said, never underestimate, the THC is definitely needed. Any extract that doesn't contain THC, I don't even consider it to be, hemp extract.
Now, you heard it from RicK himself. Hey, talk to you in a minute. Now listen, this is it. It's the same for all major diseases. You need about 60 grams. It costs, but you gotta have that. There's no way around it. Listen to RicK. Listen to RicK. Listen to RicK.
So we all have to find our own levels and comfort zones. When people are taking the oil to treat serious disease or just to reset their bodies back to a healthy state, I suggest to them that they ingest 60 grams of high-grade oil as quickly as possible. For the average person, it usually takes about 90 days to ingest this amount of oil. But I've seen people ingest 60 grams in 30 days and cure their terminal in a month. Now we have seen this, and more than once. This is very potent. So you start off with little tiny doses, about half the size of a grain of dry rice. Just little tiny doses, 3 to 4 times a day, and then after about 4 days, increase your dose. And as time goes on, about every 4 days, just keep increasing. The object would be like for them to ingest about 60 grams of this high-grade oil as quickly as they can. Now, in most cases, usually within 3 months, they can take it. But I've had patients take the whole treatment in like a month. People with terminal cancers cured in a month.
So the bottom line, I travel all over the world. I'm in California right now. I'm in free states all the time. And it's people, I find them all the time. They're being healed. They're being helped. They're helping their family members. There's different things going on. And this lady here, this video was called Hemp Works, Kicks Kidney Disease. She had great results, had her test back. You can find that by searching, but listen to what she's saying.
Stopped producing urine over 6 months ago, she starts to realize, wait, this CBD oil, there might be something to it. That might be what's working for him. So all in all, he's doing phenomenal. His kidney function has increased more. He still needs a transplant. It's not going to return back to full kidney function, but his kidneys have improved. They're still working. And this time, a year and a half ago, he was in kidney failure. His kidneys were operating at 3%. He was producing 0 urine, and he was having they're called TIAs, mini strokes, because of it, because he had fluid overload, and his blood pressure was about 260 over, I think it was 130, and that's extremely high and dangerous. It was throwing him into having mini strokes. Hey, if you're angry, get off my live. It was throwing him into many strokes. He had high blood pressure, high cholesterol. His ocular levels were through the roof. He had red blood cell vessels popping daily. And he was just in an overall bad state. He went into a diabetic coma for about 32 hours. And when he woke up, they were like, you have end-stage kidney failure. Your kidneys are not operating. And then today, his doctor tells us that he has improved kidney function. He should have not been producing urine at this state, and he is still producing 2 full liters of urine a day, which is normal for an adult male his age. So, this is just mind-blowing. I had to come on and share it with you. I really hope whoever is putting angry faces, it's an accident. But anyways, I really wanted to hop on and share this information with you because it was truly amazing to hear this. And, I'm a firm cannabis activist. I've seen what it can do for me, for my family, for my mom, for my aunts, for almost my entire family. I've seen what it can do. And so to get this news today just really, really was exciting for us. So thank you for watching. I had to share it with you.